to our next guest. Two things are happening right now that is affecting our overall mental health. One, the anxiety about the danger and threat of this COVID-19, combined with the hassles and adjustments that we're all having to make in our daily routines, like working from home, social distancing, self-isolation, all these new words we have. Dr. Simon Sherry is here to give us 5 free minutes of therapy to help us keep a level head about all this. He's a clinical psychologist and joins us now live from his office in Halifax. So good morning, doctor. Thanks for this. Maybe start off by telling us, which groups are at most risk of increased, mental illness here, and what advice or tips would you give them this morning who are watching?
The good news is that we will expect the general population, the vast majority of the general population, to recover. Currently, we're experiencing panic and anxiety and stress and intrusive thoughts, but people are adaptive and resilient and will rebound, usually within a matter of months to weeks. However, there's a subset of people who seem particularly vulnerable. We learned this from SARS, we learned this from H1N1, and those would be individuals who get affected directly by the virus, as well as healthcare professionals who are battling against the virus. And unfortunately, those individuals will be exposed to more mental health illness, such as symptoms of PTSD, symptoms of anxiety, or symptoms of depression.
And you are breaking up a little bit, but we'll try and power through here because I really want to get some advice. So what advice or tips would you give to those people maybe who are in self-isolation now, just back from a vacation for 14 days, and those healthcare workers who have to go into work today?
I think that it's important to recognize that the social distancing measures we're participating in don't require psychological or emotional distance. You can still be effectively connected to someone. You can still maintain a close supportive tie to someone. And I think it's important for Nova Scotians to recognize the opportunity in all of this. There's an unprecedented time here for us to come together and to pull together as a community and to see those within our community who are most vulnerable, such as the elderly, the immune compromised, and to move toward helping them.
Mm-hmm. Now, if you could put me on your couch there behind you, 2 kids at home, mom and dad are at home as well. They're not sure about their work. They're on their phones trying to figure out, how to apply for EI. The son wants to play Lego. The daughter is teething. And you're only at day 3 of self-isolation and social distancing in what could be weeks or months. What do you tell the families out there who are trying to figure all this out with children in the wings?
In many ways, you could have just been describing the Sherry household. There's a lot of challenges in front of us right now. One thing I would encourage people to do is to not be passive, not be ruminative, not be worried. In contrast, take an active problem-solving approach that focuses on being engaged. For example, in the middle of all this, there are wonderful teaching opportunities for children to teach them about pro-social values, to teach them about helping others, to teach them about supporting neighbors or some of our more vulnerable members of our population. And I think that what would really be a problem here is if people get passive and people get sedentary. And in contrast, what we want people to do is to remain active, albeit within the confines of their house or their neighborhood, be creative, be problem solvers, and also be focused on the task of maintaining the recommendations in place, such as sneeze etiquette or hand hygiene and the like.
Okay, excellent stuff there. Another thing I was going to ask too is this social distancing experiment that we're partaking in here. There is no real history on it going on for months. How do we come out the other side of this, and what are some of the things we can expect once we do come out that could change society?
I think one difficulty we have here is prior to our crisis with COVID-19, Canadians and Americans were already in high levels of loneliness, in high levels of isolation. So this current crisis that we're passing through probably makes worse some pre-existing difficulties for a lot of North Americans. So I do expect that loneliness and disconnection will be problems during and after this crisis because there were also problems before. I think, however, that we do really have a chance here to emphasize community and to emphasize connection in the middle of all this. With work changing, or in some cases work stopping, there's a greater opportunity now as compared to previously to focus on family, to build connections, because there are fewer of the stressors related to work. So many of us were challenged by work-life balance in our usual work routine. Spot the opportunity in all this to connect more to family and to friends and other loved ones.
And if you're like the Brothers family, you set up a Nintendo Wii and play Super Mario Brothers for an hour yesterday. That kept everyone entertained for a little while.
That sounds like an active and a great use of positive coping.
Exactly, yes. Except for Bowser. I still can't beat Bowser in that level 3. Anyway, thanks so much for the time. I know it's a serious situation we're dealing with here, but always good to get some tips and advice to keep us all on level footing. Dr. Sherry, I know you're busy. Thanks so much this morning. We appreciate it.
I enjoyed our conversation. Thank you.